Welcome to AFMC TV. I'm Robin Lipschitz.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching. Have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Dr. Riley Lipschitz. She's a primary care physician at Baptist Health and Chief Medical Officer for Population Health. Dr. Lipschitz, thanks for being here.
Thanks for having me.
So we're talking about routine health screenings, things that are important for adults. What are or why are routine health screenings so important, even if someone feels healthy?
I mean, routine health screenings are probably even more important when you feel healthy, right? You want to be able to go see your clinician when things are going fine so that we can, one, detect things early, prevent problems when we can, and really tailor what's the right journey for you to be as healthy as you can, because we have screenings that are generic for all patients, but then you kind of tailor your recommendations based off of the unique circumstances of each of an individual person.
And when you say individual person, age falls into that? Is it different for someone, say, in their 20s and 30s versus 40s and 50s?
Absolutely. So age goes into it. When you're in your 20s and 30s, there's not that much routine cancer screening that you're worried about. By the time you hit 45, that starts to stack up. By the time you hit 65, you're going to need vaccines that you didn't need when you were 20. So age makes a big difference. Family history makes a big difference. So if you have a family history of colon cancer, the recommendations for screening is going to be different for you. So I think that's kind of the important thing, is that if you have a good relationship with your primary care clinician, you're going to be able to kind of right size the screening recommendations that's based off of your age, your circumstances, your family history, your genetics, your lifestyle.
And what are the key screenings for adults that they should begin in their 20s and 30s?
So when you're in your 20s and 30s, I think the screenings from they split along gender lines. So for women, you start getting pap smears at over the age of 20, and between 20 and 30, you need a pap smear every 3 years. Once you hit 30, you can get a special HPV screening, which is the virus that's most commonly associated with cervical cancer. And if that's normal, it's every 5. So pap smears for sure are on the list. And then the ones that you really need to think about in your 20s and 30s is like screening for depression, mental health, screening for anxiety, screening for diabetes if your BMI is over 35. So if you're carrying a lot of extra weight, you probably need to be screened for diabetes. Hypertension, if you've got a family history of early heart attack or stroke, screening cholesterol maybe once in your 20s and 30s is recommended. But the big picture at that age and stage of life is really talking about what are the lifestyle things that you need to be employing to keep yourself healthy. And then we start adding to the list of screenings as you get older.
So what changes are recommended for screenings as patients reach their 40s and 50s?
The biggest ones, once you hit 40, that's where I kind of say, all right, you need a primary care doctor, right? If you're 40 and you haven't seen a doctor in a while, go see somebody and develop a relationship, because primary care is a relationship you build over time. And that's how we really get to know what's going to be best for you. But once you hit 40, we need to be screening for high blood pressure. We need to be checking your cholesterol once every 3 to 5 years if it's normal. If you're carrying extra weight, we need to check screening for diabetes, sometimes check liver function to make sure you're not getting fatty liver. Some people, if you carry a lot of weight in your belly, you get fat around your liver, and that can lead to cirrhosis. So you want to check that early. Once you hit 45, you need colon cancer screenings. So colon cancer screening used to start at 50, and everybody kind of had that number in their mind. It's like, oh, I'm 50, I'm going to have to get a colonoscopy. Whereas now it's been pushed down to 45 for all people. For women, you start mammograms at 40. Now, there's some various recommendations, and I think your GYNs might recommend one thing, a general internist like me might recommend somebody else, but we can all agree, at a minimum, every 2 years you need a mammogram. And that will get you, up till your 50s for most things.
And for adults 65 and older, what screenings become most important to maintain quality of life?
So that's a hard one, right? Because quality of life is probably more important when we talk about lifestyle, right? If you want to maintain your quality of life and you're 65, we need to be talking about how much are you walking? Like, how much exercise are you doing? What's your diet like? How's your stress? How's your mental health? So we're kind of going back to depression screening, the run-of-the-mill hypertension, chronic disease screenings. Cancer screenings, you're still on the hook for those. Breast cancer screening, colon cancer screening. If you're a smoker, you can do lung cancer screening. If you have a family history of prostate cancer and you're a man, you can get prostate cancer screening over the age of 50. But really, once you hit 65, then I start talking a lot more aggressively on what are we going to have to do to make sure you're healthy at 75? Like, what are we going to have to do to make sure you're healthy at 85? And then we all know, like, some of those 90-year-olds, and you think, I want to be like that lady, when I'm 90. It's like, well, what do you need to do now? So a lot of the screenings, I think what you can hear is each decade, the sort of screenings add up. We sort of have a foundation of stuff, and then we repeat them every year, every couple of years. And as you get older, it's even more important to kind of be vigilant about your health, because what you see is that you can be a really healthy 70-year-old, or you can be a very unhealthy 70-year-old. And that delta gets wider and wider and wider as patients get older. So if you start early, it's like, I want to be on that trajectory of the healthy group.
So what about screenings that people often overlook? Is it like hearing, vision, even mental health?
So I think, there's no great screening. There's no great recommendations for vision or hearing screenings. But the ones that you would kind of overlook that I think about on that realm is if our older adults who are starting to have hearing problems, if you notice that your mom is turning up the TV more to listen, the risk there is that you can become more isolated because you're not hearing as well. So you kind of withdraw into yourself, and then it can lead to a whole set of other problems. So screening for hearing for our older patients who might be showing some signs of hearing loss would be absolutely on that list. But again, I'd go back to depression, anxiety, substance abuse needs to be on the radar of everybody, because you don't know what it looks like, to have a substance abuse problem. Screening for sexually transmitted infections, I screen every single one of my patients for HIV at least once in their life. And I tell them, it's like, I would screen a nun, because the more people we screen, the more likelihood I'll find that one person who didn't know that they had it. That's the same is true for hepatitis C. So some of these labs where you think, why are they screening me for this? It's because on a population basis, like, we got to test everybody. We need to test basically all sexually active young women for chlamydia because they don't know that they have it. So it can be asymptomatic. These are the things that we often miss when we're thinking about screenings. Like, everybody knows about routine cancer screenings. Everybody knows about blood pressure and diabetes. But some of the other ones around sexually transmitted infections, mental health, viruses that you may not know that you have. We've heard a lot about hepatitis C over the last several decades. So those are on that list for me.
And what advice would you give patients who don't have a primary care provider or aren't sure where to even start?
I think that's also a little bit age specific. So, I don't get upset when my 20-year-olds don't have primary care doctors. It's like, okay, you don't need that much. Let's just make sure you get your screening. If you want to check in every few years, that's fine. But over the age of 40, certainly over the age of 50, if you don't have a primary care doctor, go get one. Find somebody. And often, the hard part about primary care is that a lot of people take a long time to get in with. But if it's just prevention, then you have time to wait. Like if it's going to take 6 months to get in with them to start establishing that rapport, no big deal. Just wait, get in with somebody good. There are, when it comes to primary care, I think it really needs to be a good fit for you. And when I meet somebody for the first time for primary care, I kind of tell them it's a get to know you visit. And it's not just me getting to know them, but also them getting to know me, because my style of medicine might be different than someone else's. And that needs to be a good fit, because when it comes, if I can see you kind of regularly every year or so between 40 and 50 or 50 and 60, if something bad happens, then you really have trusted, like you trust that I know you and that I'm going to make good advice, right? Or I'm going to give you good advice. So I think the first thing is to go in with, I'm trying to build a relationship with somebody and I need to be happy with this relationship. And then you just kind of start that journey. And if you've hit your middle age and you don't have a good primary care doctor, or you don't have a relationship that feels good to you, go find somebody else. Because, we all have different styles and approaches.
I think that's really good to note too, because a lot of times we don't realize, general public, that it is okay and to seek out a good fit. And just because that's the doctor that you made the appointment with, that it's okay to seek out what is a good that you feel comfortable with.
Absolutely. I mean, I'm never upset if a patient says, you know what, I don't feel like this is a good fit. I want to see your colleague. It's like, great. Like it needs to be a relationship that you build over time. And if you feel like that provider isn't hearing you or isn't validating you or isn't taking the time that they need, for whatever reason, it doesn't matter whether or not those things are true. It's how you felt. So listen to that and pick somebody who you feel like is going to be a good fit for you.
So how can providers encourage patients to stay on schedule with their screenings?
That's why we do annual wellness exams. And I really feel strongly about the annual wellness exam. Definitely if you're over the age of 65. So if you're over the age of 65 and you're on Medicare, these are special slots that we're taking time out to talk about what it's going to take to keep you healthy. And ideally, all of the screenings are in there. That's when we're going to talk about not just routine cancer prevention and lifestyle, but we're also going to talk about advanced care planning. So what would you want, if God forbid your life was shortened? If something terrible happens and you're in the hospital, what do you want? And truthfully, that's a good screener too, because that's something where we need to take time out to say, all right, we need to be on the same page. Because we cannot control what's going to happen tomorrow, right? And we have no idea what the future holds. But if you can talk about and plan for kind of the worst case scenario, you hope for the best and plan for the worst. That's all part of this sort of screening journey about promoting your health.
And what role does lifestyle, you've touched on this a little bit, but diet, exercise, even smoking cessation play alongside routine screenings and preventing disease?
I mean, it's probably the most important. I mean, honestly, when it comes to how well or how long somebody lives, what I do on the medical side accounts for maybe 20%. Everything else is what's happening in your life. Like your lifestyle, your habits, your genetics, where you live, who you surround yourself with, the organization, the community groups you're a part of. So I really aggressively encourage exercise and diet and stress management, no matter what age you are, because those are the things that are going to really pay off in the long run. And if, let's say you're doing all of those things and we screen you and you get colon cancer, you're going to be better suited to tackle it, to fight it, to go through treatment, to go through chemotherapy, whatever you need, if you have that baseline healthfulness. So lifestyle is the most important. And for my older patients, it's even more important. Like it gets more important as you get older to be moving. And what I tell, what I kind of say, once you hit 80, like every day is a gift because you never know what's going to happen. But between like 70 and 80, you're putting money in the bank for those next decades because you want to be investing in yourself. You want to be moving. You want to be exercising. The studies would show that you don't have to run a marathon to be fit. You need to walk every day as much as you can. Right? You don't have to run. You don't have to do HIIT classes. You don't have to go do CrossFit. You need to move your body and walk. And moderate exercise is significantly better than being sedentary. And then like aggressive exercise is only marginally better than moderate. And so what I say to that is, it's like, listen, it's awesome if you're doing an hour of CrossFit all the time, or if you're a marathoner, you're doing all of that. That's great. But if you're not doing anything, just start walking. I mean, just get to that baseline of walking 30 minutes at a minimum 3 times a week. And that pays off in so many ways.
Well, you answered my last question, which was give one piece of advice to adults watching about their health screenings. And you say it's taking care of yourself, in that it's exercise.
You've got to just move, right? Like you have to move. And the more that you move, the better you'll be. Because as you get older, the use it or lose it ethos is very true. And we've all seen that in our friends and our parents and our grandparents. It's like the less active they become, the harder it is to become active, the more likely they are to have bad things happen to them. And then if that bad thing does happen, it's a lot harder to bounce back. So, it's really kind of being really intentional about what you can control, right? You cannot control whether or not you're going to get breast cancer. We can screen for it. We can hope you never get it. If we do have it, we got great treatments for it. What you can control is your lifestyle.
Well, Dr. Lipschitz, thank you so much for sharing such a refreshing perspective about screenings for all ages. I appreciate you being here today.
Thanks so much. I appreciate it.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.